humans, we deal with gravity from the moment that we're conceived. So even in the womb, even though there's amniotic fluid and that's sort of mitigating gravity to some extent, there still is gravity is still having an effect on that fetus in the womb. And then when a baby is born, one of the first things they have to do is deal with gravity. All of a sudden, they have to be able to deal with this new force that occurs on their body. So from a small child, the way that the body forms is affected by gravity. Gravity has a huge impact on how our bones grow and how our muscles are structured. So the muscle and the cells in the body start to line themselves up in response to how gravity has an effect or affects them. So without gravity or with a different type of gravity, we might actually look quite different. We might actually function very differently. So it's integral to how our body forms, how it grows throughout our lifetime, and how we heal, which is fascinating. We also work a lot with people who are having issues with strength, and that's a very obvious issue where you're dealing directly with gravity. In the spine, we have discs that sit in between the vertebrae. And so I'll just bring up the spine here for a moment. And the discs sit in between each of the bones. And during the daytime, the effects of gravity cause compression through the discs, and that causes us to lose some of the fluid in the disc. So we're actually shorter at the end of the day than we are at the beginning of the day. So when we lose that height and when over time our discs dry out, then that leads to more compression through the joints in the spine. And that can cause wear and tear in the joints. That can lead to things like arthritis, where the joints get painful. There's also a space where the nerves come out. So when we lose the height of the disc, there's then less room for these nerves, and the nerves can get compressed, and that can cause pain into the legs or into the upper extremities, around the rib cage. And then learning how to, or using techniques that provide decompression can help to provide significant pain relief, not only to the spine, but to the hips and the legs. So here at Evolution, we have a yoga wall, and the yoga wall, it allows us to attach straps to the wall so that people can hang upside down from the wall and offer decompression, so taking the pressure off of the back. So with the yoga wall and using inversion or traction that's basically assisted by gravity, you'll see the effects usually immediately. And then as a yoga instructor and integrating yoga into the physical therapy programs, yoga integrates gravity, and by doing a lot of work upside down, which is something that we actually don't do as much as we get older. So we position people on the table depending on how much gravity we want them to interact with. This is a supported bridge position. This is a position that we often use in yoga to help to work on opening up the front of the hips, so stretching the front of the hips and opening up the chest. But we can use gravity in this position to help to assist the function of the pelvic floor. So the pelvic floor are the sling of muscles that go from the front of the pelvis, the pubic bone, to the tailbone. And those muscles are really important in helping to support our abdominal organs, our pelvic organs. So you're just allowing gravity to pull the viscera, so the abdominal contents down, and then as you exhale, you're actually using your abdominal muscles to lift them.